The following portion of Ozarks Fox AM is sponsored by Midwest Technical Institute.
It's Friday, so we are wrapping up Healthcare Professionals Week with Dr. Abe Abdalla, radiation oncologist and the Oncology Services Medical Director at Cox Medical Center. Doctor, great to see you. Thank you so much for coming on so early.
Thanks so much for having me, and thank you always for promoting health in our community.
Absolutely.
Yes. Well, great segue. Why is it so important to promote health in our community?
Obviously, health is a very important aspect of our minute-to-minute day for our family, for our loved ones, and ourselves. So anything to promote that is our duty, and I'm glad you're taking that seriously.
Mm-hmm. So tell us about what you're doing at Cox, being an oncologist in cancer research.
So obviously, cancer is still the second leading cause of death in this country after cardiovascular disease. Almost 600,000 people die of cancer every year. And basically, if we live long enough, 1 out of 3 to 4 of us will end up with cancer. So it's very important to be active and try to minimize our risks. So I think the best thing we could do is obviously, get no cancer. Mm-hmm. And there are a few things we can do to enhance our odds in that regard. And the second best thing is if you're gonna get it as early as you can. And that's the screening component comes to play. And at Cox Health, we have several options in terms of improving health and also screening for cancer. So in terms of, minimizing your risk to develop cancer, the obvious one, don't smoke. Mm-hmm. Smoking is still the biggest modifiable factor that we can change to minimize our odds of developing cancer. Our genes dictate everything. We can't change that.
Right.
The cards have been dealt in that regard. So, few things, healthy lifestyle. So, avoiding smoking, exercise, obesity. Obesity is actually one of the issues that, we can control to minimize our risk for developing cancer. And most cancers, actually, the incidence are decreasing slightly, except obesity-related cancers such as endometrial cancer or pancreas cancer. They are slightly on the rise. So we can modify our risks in that regard. And also in terms of catching it early, screening is so important. Mm-hmm. So mammograms for ladies, colonoscopies, skin cancer screening. Now we have lung cancer screening also over the past 5 to 6 years for smokers who are 50 or older and have 20-pack year smoking history, meaning they've smoked 2 packs a day for 10 years or 1 pack a day for 20 years or more. We can have lung cancer screening. So lung cancer screening is very important. Cervix cancer. I think the other things, vaccines for cervix cancer is very important for, it has been proven to minimize the risk of developing cervix cancer. So there are a lot of things we could do to improve our odds, and also if it happens, we catch it early. Unfortunately, we don't have screening for all cancers, but the ones we do have, we have to take advantage of them and also lead a healthy lifestyle to minimize our risks.
Mm-hmm.
And this, maybe a broad question. I was just curious to say, what is the most, I don't know what the right word is, I don't want to say popular, but the cancer that's the most prevalent?
So, breast, the top 3 are breast, prostate, and lung cancer. Those are about 300,000 ladies will develop breast cancer each year in this country. Same number, about 300,000 men will develop prostate cancer. About 250,000 people will develop lung cancer. And then you have lymphomas, colorectal cancers, Now, skin cancer is also common, but most of skin cancer, that's why skin cancer screening, and also in terms of prevention, sunscreen.
Sunscreen,
So doing all that, and you can catch it early and address it quickly.
If there's something not readily available to the naked eye, like, okay, I have a mole that looks a little weird, so I might go in. But if it's like, breast or, elsewhere inside your body, how do you do that preventative measure? How do you take that?
So, for breast, mammograms, self-exams are a must for ladies. Colonoscopies for colon cancer. Again, there are a few things we have screening for, and we should take advantage of them. And we can't, obviously, we wish we have screening for every test, but a lot of brain tumors, we can't screen for those. Pancreas cancer, which unfortunately is a deadly disease, we don't have screening. That has been proven to be beneficial. Now, medicine and mankind is improving fast. Now we have blood tests and DNA checking blood tests that might be proven down the road to help us detect other cancers early. But at this point, we have several good screening. And at Cox Health, to your point about mammogram, at Cox Health, actually Tuesday, this coming Tuesday, June 18, we're offering free mammograms for our ladies at our Ozarks clinic, which is brand new clinic. Anybody can call 417-269-LADY. You know, if you call that number, free mammograms on Tuesday, June 18th, and also September 10th. So it's free and it saves lives. So take advantage of it.
And right there, if you want more information, there is the American Cancer Society helpline and cancer.org to learn more. Everybody's going to be affected by cancer at some point. I know I have already in my life. It's something that hopefully we can find a cure for eventually. We're hoping and praying for all of your amazing technology, Doctor. Thank you so much.
Thanks for having me.
The preceding portion of Ozarks Fox AM was sponsored by Midwest Technical Institute.